What you've heard from Deborah Birx this morning, you agree with that? What do you think the action should be?
Well, look, based on the reporting, I think it's consistent with what we've been saying, that we're entering a very difficult period with this pandemic, and this is probably going to be the densest phase of the pandemic. We're probably going to see significant spread across the entire United States in a confluent epidemic. Now, we're much better prepared to deal with it, so I don't think that we're going to see the excess death that we saw with the first wave of this pandemic when it struck New York, and there was a very dense epidemic in New York. But the sheer fact that we're going to be infecting so many people right now is probably going to mean that the death tolls get well above 1,000 for a sustained period of time. And so it's a very grim couple of months that we face. I think that this is the last sort of acute phase of this pandemic that we need to go through, and things will get better in 2021, but we need to hunker down and be careful over the next couple of months.
The deaths may be a little better under control this time around, but it's the hospitalizations that really were the cause for why the economy shut down so drastically, because so much of those early cases back in March and April were concentrated in the Northeast and places like New York City. It was overwhelming the hospitals that was the huge concern. Is that a concern this time around, or is it different because these cases are more spread out across the country?
No, it's going to be a concern. There'll be parts of the country that get very pressed. And the challenge is that because you have a more diffuse epidemic across the whole country, you're not going to be able to backstop that many local regions that have very dense epidemics. Right now, there are 14 states where you have more than 200 hospitalizations per 1 million people. That's the loose threshold that the Europeans used to instigate the measures that they took, the stay-at-home orders. Now, I don't think we're going to go to that here in the United States. I don't think you'll see broad stay-at-home orders, but it is a measure that the hospitals are getting pressed. Morgan Stanley put out a good report today documenting the level of hospitalizations in different states, and that's going to continue to go up. These are still early days with this wave of virus across the United States. I think it's going to continue to build over the next 3 weeks, and Thanksgiving will probably be an inflection point where the spread will be so diffuse that the month of December, I think we're going to have to take more targeted measures to try to slow down certain activities, shut down certain congregate settings where we know spread's occurring. Again, not the broad stay-at-home orders. There's no popular support for that. We're not talking about lockdowns in the United States, but something akin to what New York did, where when they had outbreaks within certain communities, they took some targeted measures in those communities. I think you're likely to see a similar thing play out in other states.
Shepard Smith here. Thanks for watching CNBC on YouTube.